Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, the producer of Public Health on Call. Today, I speak with Dr. Susan Sherman, a professor in health behavior and society at Johns Hopkins and the founder of the Spark Women's Center in West Baltimore. We talk about the impact of law enforcement on a population not often discussed, female sex workers. Let's listen. Dr. Susan Sherman, thank you so much for joining me. Today, we're going to talk about some of your research about sex workers and their experiences and interactions with police in Baltimore. So your research found that for every abusive interaction that female sex workers had with police, there was 1.3 times the risk of experiencing client violence. So I want to unpack this a little bit. Can you explain this connection?
Well, thank you so much for having me. I think it's important first to talk about how we defined an abusive practice in the context of this research. We conducted a study among 312 street-based sex workers, the majority who were cisgender and trans women, looking at the role of police on their risk environment with outcomes of interest being violence, HIV and STIs, because much has been written about this, but not looking at an extensive range of abusive and non-abusive police practices over time, how it impacts women. So we considered abusive practices, so that means extrajudicial, including verbal or emotional harassment, sexual harassment or assault, damaging a person's property, physical violence, pressuring someone to have sex in exchange for no arrest, accepting money or goods to avoid trouble, having police as clients. And so those are what we consider. That is outside what they are allowed to do in the law, and they actually are illegal behaviors. And what we found in looking at the score, so the cumulative number of these practices, that the more women reported a higher number of these practices, the more likely that they were also to report having experienced recent client violence. So what's that saying? It's not saying that one, if you have this egregious, it's directly linked to an episode of client violence in the same moment. What it really speaks to is, in general, the elevated risk that is incurred by having these interactions with cops, which result in client violence, which is very common. So there's a relationship between these two things because police really impact women's ability. Maybe they're rushing negotiations because they're scared of being arrested or any of these abuses. Maybe they're going to unfamiliar places where they don't have friends on the lookout, where they don't really know the lay of the topography, so they don't know what buildings they can go hide behind. So it just puts them in general at risk, makes them more vulnerable for violence at the hands of clients, if that all makes sense.
In some of these cases, police were perpetrators of violence, like during an interaction where they were arresting someone and perhaps they became abusive. So there's that. There's also another side of this where they were creating sort of, for lack of a better term, a hostile environment that pushes female sex workers into, engaging in their business practices in places that might be riskier. They are moving away from where they might have interactions with police. And in doing so, they are putting themselves in a situation where they might not understand what the risks are. So there's that side of it. The other side of it here is that you've also done research about that police themselves are clients of these people. So talk about that research a little bit.
We examined predictors of police being clients over the 12-month course of this study, which was called the Sapphire Study. And in it, we found that factors that were associated with recent police being clients included arrest, a higher number of those egregious practices that I talked about, and also having a prevalent STI. We tested women for gonorrhea and chlamydia. So women that reported police as clients were 2.5. So women who tested positive for chlamydia and or gonorrhea had an elevated odds of 2.4 of having a police as client, of reporting a police as a client. So again, it's not saying that women get an STI from having a police as client, but it speaks to the general hostile environment and what are the factors that exist together that are associated with police as client: arrest, being coerced or forced to have sex, and experiencing a higher number of those egregious police practices, and having an STI. So while we didn't ask women, and this was, you always think about hindsight is 2020, we didn't ask women, did you experience these egregious behaviors when you were having sex with police? Did you consider someone a client if they didn't pay you every time you had sex with them? So we don't know those nuances, but this cluster of factors really point towards a lack of volition likely and extrajudicial behavior on the part of police that occurred when they had sex with sex workers.
So there's an issue of consent here. When the people that you are interviewing are talking about having police as clients, you're not sure if that's a consensual fee for services situation. But what it's looking at is that there is this sort of hostile relationship between police and female sex workers. And your research is looking at different angles that this hostility is existing. Is that correct? Is that fair to say?
Yes. And I think what it really speaks to is, sex work is criminalized. And you have people that, quite frankly, it's only sex work in Maryland, for example. People can only be arrested for sex work if they're actively engaged in the process. So it's usually a task force that's doing a sting, tricking women into selling sex when they can get arrested. So you have to remember that a lot of the cops that we are talking about are just doing their regular business and likely going to arrest them in the case of the cisgender women in our sample for drugs, something related to drugs or paraphernalia, because 99% of them use drugs, illegal drugs. So basically, when you have police having so much power, when sex work is decriminalized and when sex work is criminalized, the hostile environment, honestly, is created by that criminalization and the fact that the police are the representatives of the law. So I want to really focus on the broader context of the illegality of sex work and, the climate that you were talking about that's hostile towards women.
And this is not a population that gets talked about very often, but let's zoom out a little bit and talk about decriminalization and where the conversation is. We've talked a lot about Baltimore, but where is the conversation in Maryland? And we've seen, for example, in Brooklyn, where the district attorney there has stated that they will be dismissing cases related to prostitution and loitering. They've been declining to prosecute these cases. Is this a step in the right direction, or where is the conversation around decriminalization of sex work?
Yeah, I think there's an active conversation. It's been brought forth in DC, decriminalization in New York in this year, early 2021. A law that when people could be arrested for walking while trans, Governor Cuomo signed a bill that repealed this anti-loitering law that was commonly referred to as walking while trans. So I think that, and in Baltimore, also Marilyn Mosby, the state's attorney, has stopped prosecuting prostitution cases. So I think that there are efforts happening both at the discretion of prosecutors, like you talked about in Brooklyn, what's happening in Baltimore, but equally more importantly is advocacy efforts for state legislatures to decriminalize sex work so it's in the law. And that's something that's really important. And I think that as there is a national conversation about decriminalization of drugs, in Oregon, low-level drug offenses have been decriminalized throughout the state. That's happening effectively in Baltimore, where the state's attorney, once again, is for low-level drug possessions since the beginning. COVID is not prosecuting. I think that in some ways, decriminalizing sex work will ride on the coattails of decriminalizing drug use, but it is absolutely distinct, has its own advocacy efforts, and sex work doesn't just occur in the context of drug use. And, you ask, why isn't there more of a conversation about these women? Why is this kind of big gendered footprint of police violence and drugs? Why don't we talk about that? And I think that that's, sexism and the patriarchy and power over women and subjugating women sexually and physically knows no bounds. And it's very pronounced on the street. And part of the job that I feel that I have with an amazing team of doctoral students and staff, fellow investigators, what we have is really, as rigorously as possible, documenting these events and then having them used for advocacy. And I appreciate, you're talking to us today, because I think it's really important for people to think about this. There is always a different story, often for women, what you hear in the news about people who use drugs, about law enforcement's impact on communities. And this population, because of our weird puritanical origins, it is hard to talk and think about sex workers as having rights, even though since 1996, the International Labor Organization has recognized sex work as a legitimate form of work.
And I also just want to call attention to not only your research that is helping to advance some of these legislative changes, but you are the founder of the Spark Women's Center in West Baltimore, which is a center where sex workers can come for harm reduction services, such as syringe service programs and medicated assisted treatment, as well as social services like healthcare, counseling, and other support services. You have very much been a part of supporting this community of people. You're not just researching them, you are also very much working with them to identify areas that need this attention. So talk a little bit about other research that you might have going on or where things are today.
Right. So thanks. I founded Spark, but with a lot of people, and it offers services to anyone who walks through the door that doesn't identify as a man. And we also have legal services, food pantry, and I'll just say, and free shopping and yoga and twerking workshops and a book club. During COVID, our doors are not open, although we're about to start giving vaccines from our nurse from the health department, who is part-time with us, part-time with the health department, employed by the health department. And also we've been going out since April, doing mobile drop-offs of everything that you can imagine that you just mentioned: syringes, food, clothes, hand warmers. And we reach about 180 people a week. People get to kind of select from a menu of things they need. We make drop-offs. All of our staff is COVID safe. No one's gotten infected. Everyone now is vaccinated who's doing this work. Other research that we're doing, we continue to evaluate, and we're putting out papers. We ended the study, collected all the data, and we're evaluating the impact of Spark, the drop-in and our outreach services. We're about to start a study looking at correlates of COVID testing, vaccine acceptability among women who use drugs, so a little bit broader category than women who sell sex, because we know sex exchange is very fluid, and as is drug use. But we think that it's an equally and broader category for women who are at risk of a lot of outcomes. And we're hoping to have a mobile van with drug checking and prep services for people who use drugs that I'm happy to come and talk about it another time when that gets started. But kind of a range of harm reduction research focusing on providing services for this population.
And so, again, thank you for your work with this population, which is not often discussed, and also for your work in helping us to understand this impact of law enforcement on a community of people that isn't necessarily making the headlines the way some of these other situations are. Is there anything else that we should know about this conversation or that you want to add?
Yeah, thank you. I don't want people to leave this conversation thinking that what we're talking about is all police. There are a lot of good police out there. It is a hard thing being a police person in Baltimore City, working in environments that are really intense. There are a lot of ill will, particularly from past police practices of arresting everyone standing on a corner, and the war on drugs that cops implemented that largely impacted Black and brown people is real and has incredible long-term collateral damage. But not all cops are bad. They're put in difficult situations, and there are a lot of bad actors. I also don't want to minimize all of the things that we hear about, all of the young African-American men and women that we've seen being treated horribly, killed at the hands of police. This is no way. This is an and conversation, not an or conversation.
Susan Sherman, thank you so much.
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.